Medicine being part of NUS and School of Medicine is just part of the story because, and this is important to understand mentoring, longitudinal mentoring as well, that the School of Medicine is part of a bigger system called the National University Hospital System, or NUHS. This is what we call academic health center, where we have combined three national centers, heart, skin, and cardiac national centers. The three acute hospitals, which are National University Hospital, Alexandra Hospital, and Untitled Hospital. These are tertiary and quaternary care hospitals. 2 community step-down community hospitals, 6 polyclinics, which are primary care, and 3 family medicine clinics, and 3 primary care networks, along with 4 schools, medical school, nursing school, dentistry, public health, and soon to be the pharmacy department as well. So this constitutes the entire National University Health System, which we are now belong to, or most of our alliance are with the National University Health System. And this is basically governed by a board of governors from Ministry of Health and Ministry of Education through National University of Singapore. And this enables us a through and through education system, which can combine interprofessional education from all the way up, from undergraduate to specialist training to continuous professional development. And in Singapore, we have 3 such academic health centers centered around the School of Medicine at Yong Lu Lin, that is the National University Health System. The second medical school, Lee Kong Chiang School of Medicine, it's a National Healthcare Group. That's the second academic health center. And the third academic health center is centered around, and of course with the Tan Tock Seng Hospital. And the third academic health system is centered around Duke NUS Graduate Medical School, and with the Singapore General Hospital, it's a Sing Health Academic Health System cluster. So these 3 clusters actually provides us with not only training, but also mentoring from all the way from undergraduate to postgraduate and continuous professional development, or CME program, for medical, nursing, and also other programs such as pharmacy and allied health. Okay, we have to put this disclaimer because any outside workshop, we have to share that these ideas are entirely ours, except for specific mentioned and referenced. Okay, so what am I going to share within the next 15 to 20 minutes? First of all, I'm going to focus on the trust or engagement efforts of our students and trainees, and how important that is for the mentor-mentee or trainer-trainee relationships, some of the best evidence, and then overview of mentoring in our medical school. Okay, I want to start off by sharing a very recent study published in the British Medical EMJ and was taken up by The Guardian, that there's quite a lot of problems in our system. And this is not only in the UK, it is more or less everywhere, that that most of the doctors, especially the juniors, they are losing confidence, harms their careers, personal lives because of bullying and abuse in training. And this is quite rampant, and it is seen in almost everywhere. And this particular study, the ACGME is the US residency program, which is also in Singapore. This is also, we are also part of ACGME. They accredit our residency programs. So what they found is that 10-year study in 2014, they published this in Academic Medicine, that the highest cause of deaths after cancer, which of course you can't avoid in trainees, postgraduate trainees, is suicide. And they found that the highest death or the suicides they see in the early years of residency, especially in the second year. And this is a 15-year study. And Timothy Brigham and the others are also the accreditors for Singapore as well. So they shared that this actually shocked them, and they have, because of that, they have started a major problem. And similar study was conducted by my colleague Tan Chehun and her colleague, and our results are also quite eye-opening. Well, I think the most important thing is that how do we build this trust? How do we get our trainees, our students, our junior colleagues to trust, to build trust with their supervisors, with their faculty, with their clinical trainers, as well as their colleagues. This is quite important. And one of the things is that the trust to be developed, it takes time. And mentoring is one of the cornerstones in developing this trust. And once you develop trust between these parties, it also develops the resilience in our trainees, in our junior colleagues, as well as our postgraduate trainees as well. So I think this is an area that we are now increasingly putting more focus on in all training programs, as well as onboarding programs for different departments, clinical hospitals, etc. Now, there are a few things. Before I go into mentoring itself, I'm focusing a lot more on trust. There are a few things that can impact or harm this trust. First of all, credibility. I think it is extremely important. The credibility that the faculty or their supervisors keep to their word, do what they would, and also that they make accurate and honest statements of fact to students, how they are progressing, and also told the truth. And there's very interesting work done by, a lot of work has been done by Agunis and co-workers. And this is quite well known. And these areas have been studied for a long time, more than 30, 40 years. So we do know a lot on how to develop our mentorship programs and how to develop our supervisory programs, as well as training our supervisors and mentors. The second thing is the trustworthiness. Trustworthiness is that how can the trainees or the juniors trust their mentors or supervisors. So these are some areas that we need to remember, that when the supervisors or the faculty give credit to students and trainees for their contributions, did not take students and trainees' ideas as their own, and did not prescribe unrelated tasks that the juniors are not capable of doing without supervision, and did not manipulate students to their own end. And it's very telling that most of the studies actually show that when you do this, how the trust is broken, and how that the senior, junior, or student faculty relationships are harmed. There are two more slides on this, and then I focus on mentoring. But these are important. Again, another area trust can be affected is what they call the power games. Hagler and Casey has been doing a lot of work. Again, this is not new. It's about 30, 40 years. And there are some very interesting books being published as well. And I think the most important is that we need to understand these power games. And especially power games are played by the faculty when the faculty lacks confidence, and also when the faculty do not want to be the bad person, or are scared to give negative feedback to their trainees. That's because they have not developed enough trust with the student or the trainee or their junior colleagues. They also feel, when they feel threatened, then they try to play these power games, and also when they want to just reduce their responsibilities of supervision or mentoring. The students or the residents also play the power game by flattery, right? By praising unnecessarily their mentor, supervisor. Also, taking self-pity, self-depreciation, playing the victim, and also playing the emotional blackmail game. So one of the important things is that we need to understand these power games, because it can harm the trust that we develop with our juniors, our trainees, our students, and understand why they are playing this. We need to also think of our own credibility, our own consciousness, and understand why that such things are being played, and you need to know that we shouldn't get manipulated by this. Okay, so I think what I'm trying to focus is that a lot has been focused on how to build trust, but it is ultimately one's own professionalism. And this is the most precious commodity in medical education or in medicine. Right, so now let's focus very quickly on mentoring and what are some of the areas that we need to focus. And also from there, I will go on to how we have aligned ourselves to these mentoring processes as well. Right, so first of all, we need to understand, as we discussed trust earlier, mentoring is relationship oriented. You can't be a mentor until we put our time and effort to build that relationship, right? Because the moment that relationship is weak, then the mentoring falls through. So the most important thing is that how do we build this relationship with our student or trainee, right? It is a long-term thing. Mentoring is not just one semester and then you change over, or 1 year. And this we have also realized. So now most of our mentoring programs are more longitudinal, and it is purpose-driven. So what will I mean by purpose-driven? It is developmental-driven. So there are milestones, that clear milestones we put in we put in place. And how do we develop those milestones? I will come to later. And it is important that we follow this thing up, and there's a plan, there's a developmental plan, and we monitor that. And that is the only way to see whether a mentoring relationship is happening properly, and also to see whether we need to take some remedial measures to ensure that the process can be improved, or whether we need to allocate another mentor. The next is that because of this, we have to spend a little bit of time designing this. And how do we design this? We need to co-create this mentoring process based on the first principles with our students and trainees. We also need to agree on these areas. And these are the agreements that we come to at the very beginning, so that it's very clear with the trainee or students the purpose of this mentoring, and also with the faculty member. Very often, we do not get the immediate supervisor involved in the mentoring, and most of the time it is that we work with the mentors are not their immediate supervisors for obvious reasons. So when do we use a mentor? Basically, we use them to motivate our junior colleagues or the others, to inspire them, to enhance their leadership development, transfer knowledge from junior to senior, inculcate some of the organizational behaviors or professionalism attributes, and also we use mentoring process when we want when succession planning. So in all departments, or all our departments, everywhere at NUS or in other institutions, we have to develop our successor, and a couple of successors actually we need to mentor, and that this is a place where the mentors are used in a big way. Right. So with this, I now come to how do we actually develop a mentoring plan. Now there are 3 stages. First of all, when we start mentoring, we need to create awareness, right? Why are we mentoring? What's the reason for mentoring? So this is where we focus on what's the real situation, and we get our mentee to reflect on this. Second, clarity, right? So clarity is where we discuss with our mentee and set goals, right? We want to see what are the ultimate desire of this mentor relationship. What do you want to get out of this, right? And what are the final goals? And here we also discuss what are some of the concerns, the problems, and the challenges. The third is based on the above 2, then we develop the plan of action. What is next? What are we going to achieve? And what is the final fulfillment or achievement of desire or goal or outcome? Now, why is that? First of all, we want the mentoring from becoming reactive to more receptive, right? So we do not want a mentoring relationship where the mentor is always reacting to a certain situation. Oh, I am having this problem, so what can we do about it? So we are moving from just reacting to a particular situation to again seeing the bigger picture. Achieving clarity is basically to discover what really matters at the end. It's not that but one incident or two incidents happening or one or two challenges, but what's the bigger picture? So if we are going to achieve that bigger picture, when we work with our mentee, we can then get it across to them that we are actually focusing on a much larger picture, and let's not focus on individual issues or challenges that come across. Of course, they are important, but the focus is not on just one or two or three incidents, but much larger picture. And then, of course, the last part is co-creating that vision with your mentee. And it has to be co-created with the mentee, because otherwise it is someone else's plan. It is not the mentee's plan. And this has to help the mentee. And that's where the mentor and mentee gets together. They both co-create the plan or the roadmap or the strategy, and based on the available resources. So this is in short, right, how we engage in developing the mentoring plan. Now, one of the key attributes, I think Chehun will share a little bit about this when she's talking about feedback. It's about listening, right? Another area that we focus a lot is that how do we develop the art of listening for the mentor? We always say the mentor-mentee relationship, if the mentor speaks most of the time, it's not a good mentor-mentee situation. We need to let the mentee speak and the mentor to listen attentively. So how do we do that? Actually, I will send you this link. I'm not going to go into details in this because it's a workshop by itself, how to listen, how to develop listening skills. But I think the first most important thing is that just how do we develop our ability to pay attention when someone is talking? How do we develop ourselves to withhold judgment? And this is extremely difficult. I can tell you, being a faculty developer for more than 15 years, I myself had to retrain myself to withhold judgment when I listen to something and when I see something on television or on news channels or on paper, right? So withholding judgment and be open is something quite challenging, but a must for a mentor to develop. The third part is that the reflective ability. Not only the mentee, but the mentor must also develop this reflective ability. And once we get used to this reflections, ability to reflect while listening, it becomes a habit. And then, of course, clarification, how to clarify certain things, because if they're not clear, and summarizing it so that the mentee can understand, also mentee can then focus as well, and then of course share your ideas on how best to mitigate certain situations. So we are trying these in our workshops, and we are trying to get this habit inculcated in our mentees as well as our supervisors, so that they don't react and they don't say something that they will regret later, or they won't do something that they would regret later as well. So this is an important skill that we try to get all our mentees, mentors, as well as the supervisors also. Right. So one of the important things that I just wanted to share is that how one of the things that we actually get through this listening skills is how best to listen to someone when someone is sharing a story. So we share that there are two layers to this when someone is sharing something about a story or something a mentee is going through, etc. So the first layer is that the mentee will share about, or the junior colleague will share about the context and details of the story. And this is where we put a lot of emphasis on. We focus, okay, what happened, who did it, what was the thing, right? When did it happen, and who was there, etc. Unfortunately, we pay a lot of attention to the context. But in a mentor-mentee relationship, if you had followed me earlier, we are looking at the much bigger picture. We are trying to get the person from where that person is, the mentee is, to a higher level of performance and higher level of development. So I think what we try to do with our mentorship training is to get our mentors not to focus on the first layer, the context or the details of the story, but about the emotions behind that. So we try to get the mentor to ask questions like, what really, what are your emotions behind that? Why are you angry because that happened? Why are you happy because it happened? Right? So what are your concerns? Did it actually impact on your integrity, or did you felt humiliated? So the second layer, we focus a lot on emotions, because if the person understands, the mentee understands that rather than the details, the emotions, then they develop how to control, or you can help them to develop how to control the emotions behind that particular situation. And that is important, because once you start controlling your emotions, then you can bring that person from being.
He also should be there. That doesn't mean we should take all.
So once you start doing that, you actually get that, your relationship, or the mentor-mentee relationship, moves from a transactional, right, to a more transformational situation. So you are not reacting, okay, that is what happened, is that what happened, so then I will talk to the transformational. So you are moving that person from just focusing on a situation to a more transformational, or looking at the bigger picture and controlling one's emotions, controlling one's feelings, so that they can then shift to the next stage, and they can focus on what needs to be done. So this is done through asking the right questions, right? So these are some of the questions we specifically train our mentors to go through. So first part is that, setting the stage, and what is in blue is clarifying. For example, clarification, especially in listening, you need to clarify certain things. For example, when you say this, what do you mean? Or can you please expand or elaborate on this? And then focusing on the emotions, the second layer of that particular sharing or the story is where in red, right? So when this happened, why is it important to you? What makes this particular incident important to you? Or what positive difference this particular incident brings to you? So we try to focus more on the emotions behind, and also, first of all, clarifying, and then emotions, so that we can focus more on transformational change rather than a transactional change. So this actually brings a lot is spent on how to ask the right questions and how to create the right environment with the mentee. And because once you do this through questioning, you can connect, you can develop that relationship, that trustworthiness. It also promotes deeper understanding, get the person, for both parties, to reflect, focus on attention that needs more clarity, and focus on developing more deeper clarity, so that you can pay more attention to important areas. And also, I think the more important thing is that you bring the mentee from a negative mindset to a more positive frame of mind. I think that is important. So I'm just have a couple of more slides before I share what we do at School of Medicine and at National University Health System. Um, we all work on this, what we call the expertise, Dreyfus expertise cycle, expertise framework, and the skill will metrics. So we all know that we are at different stages of expertise. Most of us in our own fields are experts, but our students are at a novice stage, or our postgraduate trainees like residents are at least at advanced beginner or competent level. Our junior colleagues may be at a proficient level. So we need to understand that they are at different levels of this Dreyfus skills cycle or the skills framework. And one of the things is that it's a journey, right? And one of the important things is that in this journey, we need to mentor them. We need to provide the right supervision at the right time, and we need to provide the right coaching at the right time. And if you provide the wrong intervention, if you give the wrong intervention or the wrong medicine at the wrong time, then it becomes challenging. Especially, we use this skill will metrics to determine that. So you can see that when a person has a low will and low skill, there's no point trying to supervise or coach them. But what is more important is to bring up their motivation or their will. Will is motivation. So bring up their will, and it's the same. If the will is low, if the person's skill is so high, but the will is low, that you cannot get them to do anything. So supervision or coaching is not going to be effective there. So once we identify in the skill will metrics where their skill levels and the will or the motivation are, then you need to think what is the right intervention that we need to give. So when the will is low, the right intervention is mentoring, right? By mentoring, you bring the motivation or the will up. So once it is there, once the will, you focus on the motivation, and when the motivation is up, then you focus on the skill, and that's where the supervision comes in, right? And then once your motivation as well as your skill sets are quite high and you are right there, it's where the coaching comes in. So we have specific interventions for specific groups of people, especially even for students and trainees. And it is important for us to understand where the mentoring would come in and where the coaching and supervision would come in. So as I shared earlier, these next few slides, 5 minutes max, I will share some of the things that we do. I shared that this is a problem in the United States. And I also shared that we are not too far away in Singapore. At this particular study recently published also shares that we are also having high rate of burnout, especially in residents. So because of this, the School of Medicine, we changed our vision, mission, and values. And one of the important things is that at NUS, we don't just stick to this vision, mission, and values on a board on a wall and forget about it. We actually put in measures to measure that whether this mission is achieved as well as the vision, and we are inculcating the core values to our students. So this particular statement is extremely important, and it goes into all our departmental and centers as well as individual faculties performance indicators. So how do we do that? First and foremost, I'm focusing on the mentoring itself. So this is part of our core curriculum for our medical students. So you can see that there are mostly the 5 specific programs focused on developing the mentoring skill, the mentor-mentee relationships, and developing the resilience of our medical students and giving them that broader perspective. The health track, or what is called the health ethics, law, and professionalism track. It's a longitudinal track, starts from year 1 and goes all the way up to the final year in the 5th year. It focuses on giving the conceptual and knowledge-based cognitive skills to the students starting from year 1 itself. And the health track is incorporated into all the system-based modules and then the clinical postings as well. It's not a separate track and it is not assessed separately. It is part and parcel of their assessments within the system-based modules in year 1 and year 2, and in the clinical years, all the clinical postings and the clinical, the 3rd year, 4th year, and the final year clinical exams. The next is the longitudinal patient experience, where a medical student, nursing student, pharmacy students, and dental student are put together, and they are given from the day one a family with a patient with a chronic illness, and they follow this patient and the family up. And this is again longitudinal, and in the first few years, their focus is on understanding some of the challenges that these families go through with a patient with a chronic illness. And sometimes the patient dies, and then they actually get involved, and they are part of this family, and they document, and they're supervised by a faculty member. The Global Health Leadership Program is to give a much broader sense beyond the Singapore's boundaries for the students to see and engage in longitudinal programs that we have with other partnering universities and medical schools outside Singapore. So we have 7 programs with India, Myanmar, Indonesia, Cambodia. These are longitudinal, means that these programs are continuous. They don't end with one student group. And these are certainly not like the medical tourism where the students go spend a little time, run a clinic and come back. But there are definite goals that the students need to achieve. And when they go out and then they do that, that is part of their curriculum in year 3. Starting from year 1. And there's a more focused program in year 3 and in year 4. But this is a continuous program from year 1 all the way up to their final year. The patient-based program is again another program for year 1 and year 2 students, where the relevance of biomedical sciences and importance of patient-centered care and the values are given. And these are all areas that there's a mentor who will work with their students, understanding and unbundling some of the complex situations and complex scenarios that they will come across. And then finally, we have this Enrich program, Nurture, Respect, Integrity, Compassion, and Humility through Mentorship program, which again is another program where we are focusing on our School of Medicine's core values, how these values are being developed in our students. So these are seminars and other areas, but also there's oversight on how well that the students are developing these values. Not only these, we also have student-driven, faculty-supported events. So these are co-curricular activities. Every student who joins the university, the School of Medicine, must belong to a community service program. So this is semi-voluntary. It was voluntary before, but from last year we saw the importance, and all students must now serve within one community service program, servicing the local communities. All students belong to a house. So there are 5 houses, and all students are mentored by a house mentor, who is a senior faculty, and there's a junior faculty, and then there are peer mentors. So the senior students mentor the junior students, and they belong for the entire 5 years to one of these houses. And when they get senior, the students themselves are trained in mentorship as well, so to train others. There are many interprofessional enrichment programs with the nursing students, with the pharmacy students, dental, and also the medical social work bachelor's program students. And of course, all our students will either do during their electives a university research opportunities program, where they are linked to one of the top world-class researchers or research teams, and then they will do a research module, or they will be also attached to a university teaching program, one of the faculty members under the university teaching opportunities, and they get the opportunity to mentor and teach as a teaching assistant for their other colleagues, either in the same faculty or other faculties. This is something that we started new, UTOP, but Europe has been there for many years, and the students have gained valuable experience in some of the latest research that the university is running. Not only medical, but from science, from engineering, and other areas as well. So I think I shared about this longitudinal mentorship, but also in mentoring mentor-mentee relationships, how do we ensure that the students and the mentors are on the right track? So we have very clear guidelines, rubrics, and also framework for very clearly set out for what is expected of the mentee and what is expected from the mentor. But also it is said that there's no point in putting all this unless we train both our students and our faculty members in mentor-mentee relationships, and also how to be a good mentor. And this is something that we ourselves have discovered, and we have also done studies to show that once the faculty is properly trained and credentialed, they are much better faculty than when they are not trained. So we have multiple training programs. So myself and Chehun just finished yesterday this training program for our faculty. 30 of our faculty, 34 faculty members went through this training. And also we have specific training on different areas like feedback. Again, Chehun anchors this feedback process as well. But also similar programs for faculty on various aspects like positive psychology, etc. So I think it is extremely important that we skill our faculty to be good mentors. You can't just throw them in the deep water and expect them to be good mentors. But there's no point just training them. You need to have a framework to evaluate them. So we have this, what we call the faculty development framework. And this is a framework developed jointly by the School of Medicine, all three medical schools in Singapore, and the Ministry of Health. And under the domain, the two, teaching and facilitating learning, you can clearly see that the areas for mentorship is there. And not only that, under the same domain, very clearly, we have what we call the competencies very clearly set out, the milestones, and then which category of faculty, because we, as you can see, there are different categories of teachers, right? Some are program directors, or what we call the education department education directors in charge of programs. Some are co-clinical faculty who provides most of their time teaching, then providing clinical services or running research programs. Then we have the adjuncts like the visiting faculty. We have the exam committee members. We have what we call a specific category called the clinician educators. We also have the accrediting committees members. These are the residency accreditation committees, or the specialist training accreditation committees, or subspecialty training accreditation committee members. And we have what we call the department heads, the vice deans, the associate deans, and residency, or what we call postgraduate training deans. So you can see that milestones are specifically identified, what they need to achieve. And when it comes to coaching and mentoring, you can see there are specific milestones for the exam committee members, accreditation committee members, general doctor population and physician faculty, co-clinical faculty, and for program directors and associate program directors, they have to achieve all three levels of milestones. So this actually rubrics and the framework helps us to monitor how well our faculty are engaging in the mentoring program, and they are mentoring, supervising, and coaching our students, trainees, and junior faculty as well. But again, having rubrics and a framework does not make sense unless it is properly evaluated. So you can see this is our education performance matrix for each faculty member. And you can see that under the third domain, you can see that how the targets are developed, because the targets are different for different faculty members based on their education, what you call focus, or their area of specialty in education. Whether if they are an exam committee member, it is different to a teaching faculty or a co-teaching faculty, or a program director, etc. So you can see that based on those, you can see what are the targets set. For example, for mentors, for houses, as I mentioned earlier, it's the number of students that they are mentoring and the quality of mentoring identified by surveys. If you are a research mentor, then of course the number of students who are mentoring and the quality of mentoring by looking at some of the publications coming out from the students and the residents. So you can see that those are very clearly laid out and then agreed upon before the start of the academic year. So in summary, I think I focused a lot on why the trust is important and why a good trainee-trainer relationship or the mentoring relationship is important, because it also contributes to patient outcomes as well. And then finally, some of the best practices, and also sharing some of our own systems on making sure. So I want to thank Aloka, Gwani, and Sajid for inviting me to share some of my thoughts. And I think I will get Chehun to share very quickly about feedback. How do we focus on feedback? And then we'll have a quick question and answer sessions to clarify some of the queries. Over to you, Chehun.
Thank you, Duchipa. So we are going to share screen. Are you able to see?
Yes.
Thank you. So in the interest of time, I cannot thank so many people. I'll just follow Duchipa to say that thank you, Duchipa, and thank you the people who invited us to give this. Very quickly, I'm going to share about providing feedback for impactful mentoring experience. Duchipa touched on a very important topic of trust. So that is very important. When we provide feedback, it is a gift. We all love to receive gift, but the giver is more happy, because the ancient saying goes, there is more happiness in giving. So when we provide feedback in mentoring, we are very happy because we are providing feedback to train the mentees. Can be medical student, can be health science professional, can be doctors, junior doctors, and they are going to be good healthcare provider. So we have that in mind, that we are providing feedback in mentoring for that purpose. We are going to be clear about the goals of providing feedback. I will touch on a little bit about the role of mentor, mentee, and how to provide the feedback. Many of us here are very experienced teachers. So some of these things may be known to you. We're going to share best practices, how we can train good mentees. We begin with the end in mind. Whoever that we touch is going to be somebody going to touch other people. If you train 100 doctors, this 100 doctor will touch another 100, you multiply. It's going to be very impactful. Mentoring is to support, to develop, and to discuss with the mentees what it is their goals. Duchipa shared with us their milestones, their endpoint that you want, the role, the skills, their professional development, and their ideas and their potential. So that is mentoring. To provide feedback in the mentoring process, we want to help the mentees to have a personal assessment of their strengths, their weaknesses, what kind of skill development they want, and what they need. their career expectations and objectives. In order to provide these kind of mentoring feedback, we must have some skills. The mentor need to develop skills. That's the reason why Duchipa share with you the provisions of training of mentors. This mirror is the role of the mentor providing feedback. This mirror need to be an accurate mirror. It cannot be a concave mirror. It cannot be a convex mirror. It will provide inaccurate assessment of the mentees, and the mentee may have a wrong image of themselves. We did a study of 5 years of graduate from medical school to see what kind of role models that they have experienced in the 5-year medical school. We dissected the data, and we have 66% of the students mentioning about the role of doctors in the health science. They pointed out that the doctors as mentors is one of the key things that they remember that is most important. So these are the data from the graduate from medical school, doctor as mentor. What are the attributes? We ask ourselves, how to be a good mentor? Duchipa mentioned about listening skills, respect. Active listening. R, A, what is another R again? Reflective. Again, you can see that it was mentioned earlier on, we need to be reflective. We need to be self-aware. We need to understand our mentee. If we are not even aware of our motive to create a trust environment in order to understand the mentee, we are not a good mentor. So a good mentor, to provide feedback, we need to be a reflective person. Another E, we need to express empathy. So there's an E here. Respect, active listening, reflective, express empathy, rapport building. In order to be able to provide feedback to our mentees, to train them. As we mentioned earlier on, mentoring is a long process. It is not one-off, it's not two-off, it's a duration. So rapport building, sharing our experience with the mentee. So we go again, respect, active listening. We want to be reflective, express our empathy, rapport building, share our experience. And the last one, what is T? T is to encourage the mentee to talk. We don't want to be the person who is talking all the time. So RAREREST. I try to get this so that we can remember the RAREREST. The mentor needs to have courage, commitment to provide mentoring, feedback. We need to have the skill to do feedback. The motive, trusting motive. How can we develop that kind of quality that you can understand your mentee and to have a heart for them? And I'm going to play this YouTube to know what kind of heart we should have, what kind of quality we should have on this RAREREST.
If you're watching YouTube, you must already know that the videos you are watching are making money whenever you watch them. But do you know exactly how much can be made?
Can you hear the sound
Yeah, Cheon, we can hear the sound.
of the
But we
YouTube?
can't, yeah, but we can't see the YouTube clip.
You can see the YouTube clip.
So you have to unshare and share the YouTube. You have to unshare the slides and then you have to share the YouTube clip. Share screen and then